action.
Hi, I'm Paul, and this is the practical lesson, and what we're doing is CPR. CPR, of course, stands for cardiopulmonary resuscitation. Well, what does all that mean? Well, cardio means heart and pumping the blood around, and of course the blood does a lot of things, but one really important thing the blood does is transports oxygen. And what's the most important part of the body that needs the oxygen is, of course, the brain. Pulmonary, P for pulmonary, it's lungs and breathing. Of course, it's sucking this air in, getting the air into your lungs and get it across to those blood cells. So two things need to happen. Get the air in the throat, down to the lungs, and the heart pumping that blood around. R for resuscitation means resuscitation. We're just trying to get this person going again. For some reason, their heart hasn't worked, or it's not working properly, and they're not breathing. Why is this? Well, heart attacks is one of the big ones. Probably one of the biggest killers in Australia. It's one of the main reasons you'll be doing CPR. There's lots of other similar ones, heart failure, stroke and so on. But I think drowning would be right up there as well. Anything interferes with the breathing. Poison gas, smoke inhalation, suffocation, choking. So any reason that air can't get in, or any reason the heart isn't working properly, we need to do CPR. Now those that have done first aid before, you would have learnt all these different numbers, and just as you get to know the numbers, next time you do first aid, they change the numbers again, and it gets confusing. Well, the numbers are pretty simple now, and it's been quite a few years now, they're sticking with these numbers. 30 and 2. Easy to remember. For an adult, for a child, for a baby, one person doing it, two people doing it, it doesn't matter. 30 and 2. 30 compressions, pump on that chest 30 times. Blow some air down their throat, 2 breaths. Simple as that. Right, let's have a look. Coming in, DRS, ABC, check for danger, check for response. There's no response. I've sent for help. I've checked the airway. In this case, I've rolled over. I've checked for breathing. Remember, 10-second check. In this case, no breathing. What if I got that wrong? What if they were breathing, but I didn't pick it up? Does that mean we could be doing CPR on a person that's breathing and their heart's beating? Well, yeah. What's the worst that will happen? They might wake up and tell us to please stop doing this. If they're unconscious, you're not doing any harm. Could we break ribs doing the CPR? Yeah, we could. But we're balancing which is worst. We always assume the worst. We assume they're unconscious. If we don't find any breathing, we also assume the heart is not beating, because it probably won't be. Doesn't mean the heart's not doing anything, because in most cases the heart will be just twitching and shaking like a bowl of jelly. And then of course that's called fibrillation, ventricular fibrillation. The heart's not dead, the body's not dead, the brain is not dead. The person is still alive, but the heart's not beating and they're not breathing. But they will be dead soon. They'll be dead in about 3 to 5 minutes. It's not very long. Think of how long people can hold their breath for. Now, don't go and practice, because it's not a good idea to hold your breath too long. A lot of people have tried and they sort of hold their breath way too long. 3 to 5 minutes, not very long at all. That's our window of opportunity to get in there and try and do something. No breathing, no heartbeat. We get straight in and do the compressions. Up on your knees, elbow straight, interlock your fingers, either hand, doesn't matter, you can be either side, it doesn't matter. Those that have done first aid in the past, you would have been taught different measuring techniques. Don't worry about that now. We just go centre of the chest, between the nipples, and at a rate of about 100 a minute, which is stand alive, do, or whatever other song you want to do. So it's pretty fast. And 1, 2, 3, 4, 5. And how many of those do we do? Of course, is 30. Now I'll go through the full sequence in a minute. We're just going through the details at the moment. After 30, 2 breaths. We need to tilt their head using what's called a pistol grip. Thumb and forefinger holding under their chin to tilt back. If you put your chin right on your chest like that, you can't breathe very well. Put the head back, opens it right up. For children, Just sort of half head tilt. For babies, no head tilt. Not much of a neck on a baby, so just keep the head in what we call a neutral flat position. Block their nose, otherwise you're going to blow air down their mouth, it's going to come straight out their nose. Block their nose, pistol grip, tilt the head back, open your mouth wide, put your mouth straight onto their mouth and give them a good breath. Hang on. Can we catch disease by doing this? I don't know this person. Could I catch HIV, hepatitis, coronavirus? Yeah, possibly, yeah. Could I protect myself in some way? Nice little face shield. You can buy these, they cost like 50 cents. Single use only, of course. Could you improvise with a piece of plastic, a handkerchief, or whatever you might have? You might have one of these in your glove box. Pocket mask. That, of course, goes straight over their mouth and nose and just blows straight through. Fantastic. Spend a few more dollars, you might get one of these. Over their mouth and nose. Fantastic. And that's a bag mask. All this tubing is when you have an oxygen cylinder, and it depends how complicated you want to get. If you might be in a workplace, ask the boss, spend a few more dollars, and you get more stuff. But what if I know this person? They're a close family relative, I don't know, someone pretty special to me. I'm pretty sure I'm not going to catch anything, or I've already got it anyway, whoever this person is. Or just someone owes you a lot of money. You want to save this person's life. Open your mouth, straight over their mouth, and two good breaths. And then back to 30. For a baby, just puff your cheeks up. Just a little puff, don't blow too hard. For a child, and a child is up to 9 years old, so if they're about so large, about half a breath. And remember that, half head tilt. For a baby also, babies tend to breathe through the nose more than the mouth, so cover their mouth and nose with your mouth. If you want to use some sort of protection, that's fine as well. You can buy smaller versions of these, that's fine, or just turn it upside down. Cover the baby's entire face, and that works just fine. Likewise for these, you can get small baby and child versions, but just go upside down, works quite good. For a baby, 2 fingers. Same, 30 and 2. For a child, usually one hand should be enough, but again, 30 and 2, it's all the same. For a baby, I probably wouldn't want to do CPR on the ground. You could do, it's a long way to get down. You could possibly hold a baby, depends how old the baby is. One advantage of this, if it's possible, and it might be possible, doing CPR, and where am I going? Up to where the phone is, or to the neighbour's house or somewhere, try and get some help. You won't be able to do that, of course, with a larger person. Right, 30 and 2, pretty simple. What are we breathing into this person though? They need oxygen, but haven't we just breathed in all this oxygen and used it up? Well, not really. The atmosphere we live in is about 21% oxygen. Most of the rest is nitrogen. We don't use nitrogen. This goes in and out, doesn't do much harm. There's trace gases, a bit of carbon dioxide and a few other things, but 21% oxygen is quite a lot. We breathe it in, we'll use about 4, maybe 5%. So what we're breathing out a good maybe 16, 17% oxygen. That's more than enough for this person. That's the whole idea behind what we used to call mouth-to-mouth resuscitation, or EAR, but now it's part of course, CPR. Pumping on the chest, what does that do? Well, how big's your heart? About that big. Centre of your chest. It's not off to the left. It does lean to the left a bit, and certainly the left-hand side of the heart is bigger than the right-hand side. But people say, put your hand on your heart. No, heart's not there, heart's here. And the heart's underneath this big bone on the breast, and of course that's called the breastbone. Yep, very good. Or sternum. By squeezing on the sternum, we'll squeeze that heart. Has anyone ever been in a small boat with an outboard motor? Between the fuel tank and the motor, there's that black pump, little squeezy one. That's got valves, you squeeze it, and it pumps the fuel. That's the same as the heart. What I'm going to do now, go through the full sequence, because part of the assessment for CPR is to do it for 2 minutes. It's not a fitness test. In the real situation, you're going to do the best you can. 2 minutes, of course, quite a long time. It will be roughly 5 cycles, 5 lots of 30 and 2. So coming in, danger, response. Hello, how are you? No response. Call for help, check airway, check breathing. No breathing, straight into compressions. And we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Pistol grip, block their nose, tilt their head. Straight in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 to go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Last one. 1, 2, 3,